Our second panelist is Mona Shah, who is the policy advisor for the Orange County Women's Health Project. Mona is an independent health policy consultant and works primarily with nonprofit organizations, philanthropies, and government agencies. Mona has served as a project director for the Health Funders Partnership of Orange County and as a consultant with the OC Office of Health Management Associates. Prior to that, Mona was a senior health policy advisor to U.S. Senator Barbara Mikulski, as well as staff director for the U.S. Senate Subcommittee on Children and Families, Committee on Health, Education, and Labor and Pensions. In this role, Mona drafted several sections of the Affordable Care Act and spent time working on health-related legislation and appropriation issues. Mona currently serves on the advisory board for the Orange County Women's Health Project and the board of directors for Essential Health and Pretend City Children's Museum. Mona earned her JD from University of Maryland School of Law and her Master's in Public Health and Bachelor of Science from Emory University. So before I hand it back over, I just want you all to send some virtual love to our beautiful panelists. And I hope that you all enjoy this discussion.
I wanted to thank Allison and the entire Orange County Women's Health Project for inviting me back this year to help with the policy update. It's great to be with everyone virtually, and I'll be honest, it was nice to put on something other than pajamas or workout clothes this morning. So I'm just going to dig right in, and I'm going to focus my portion of the update on some federal legislative developments, as well as focusing on the new California budget revise that came out in May. Next slide, please. So some of you may be familiar, there were 5 major pieces of federal legislation that have been passed and signed into law, all related to the COVID-19 pandemic. The first one was relatively early on in the beginning of March, known as the Coronavirus Preparedness and Response Supplemental Appropriations Act. And that one was just to focus on coronavirus vaccine research and development. The second one, known as Families First Coronavirus Response Act, focused on providing paid sick leave, tax credits, and funding to assist with free COVID-19 testing. It also expanded food assistance and unemployment benefits, and included some provisions for increased Medicaid funding for states. Something interesting to note, some of the paid sick leave provisions only applied to employers who had employees under 500 in terms of numbers. California, actually, in April, the governor decided to sign an executive order to give at least up to 80 hours of paid sick leave, specifically to food sector workers when their employer was over 500 individuals. So that was something good to see come out of California. The third piece of legislation is probably the one that everyone is most familiar with. It's known as the CARES Act, and it stands for the Coronavirus Aid, Relief, and Economic Security Act. This bill is significant for many reasons, primarily because it is literally the largest single economic rescue plan in the history of the U.S. The country has never spent more on a single bill, and it costs $2.2 trillion. In that, there was $500 billion in direct payments to Americans, $208 billion in loans to major industries, and then $300 billion in small business administration loans. It also included something known as the Paycheck Protection Program, again, something many of you are probably familiar with. Nowadays, a lot of people refer to it as the PPP that allows employers to continue paying for their workers. And then following that, a few weeks or about a month later, there was the Payroll Protection and Healthcare Act. So it added money into the Paycheck Protection Program. Again, many of you probably heard that the funds were used very, very quickly for that. So it added an additional bucket of funds for that. And then it provided additional funding specifically to hospitals and clinics who are losing revenue and additional money for testing related to COVID-19. And then the most recent bill that was signed into law on June 5th was the Payroll Protection Program Flexibility Act, and it essentially gave business owners more flexibility and more time to use that loan money from the PPP program and still get it as forgiven. And so, next slide, please. rather than go through what was in each bill provision by provision, we thought it made more sense to just go over the larger buckets of funding that were included. And so this would be things that happened across all 5 of the different bills. And so that there was new funding for COVID-19 testing and treatment, direct payments to Americans, as I mentioned, revenue losses, community health centers, and hospitals. For example, there's something called the Provider Relief Fund, which in total is $175 billion, again, going to hospitals and community health centers. In the Families First bill, there was $100 million that was given to health centers. Specifically, California received 14 million of that. I don't know for sure how much of that has trickled down into Orange County. And then the CARES Act after that provided an additional $1.32 billion to health centers. And out of that, $193 million has come into California. So it's good to see that these funds are already coming into our state and likely into our county as well. And then there was funding for existing agencies and programs. And so these are programs that are already in existence and already get annual funding, but all of these agencies and programs got an additional boost. So for example, Healthy Start and the Temporary Assistance for Needy Family programs. The Ryan White HIV/AIDS program got a boost. Specifically, SAMHSA, which is the Substance Abuse and Mental Health Administration, given all of the new mental health issues people are facing, got increased funding, as well as the Health Resources and Services Administration. The Family Violence and Prevention Services Act got more money, and specifically programs that provide shelter to domestic violence survivors. So Congress was really looking at how can we bolster existing programs and where do we need to create new sources of funding. And then, as I already mentioned, the SBA loans, paid family sick leave, unemployment benefits. And then the other piece that Allison and I will spend some time on is, in addition to the funding part, there was some easing of federal regulations to make accessing care more easy and to make things smoother for both patients and providers when it came to the COVID-19 crisis. Next question. Next slide. So we thought we would make this a little bit interactive, and before I move forward, I'm going to ask a poll question of all of you, and that is true or false. Anyone can get tested for COVID-19 at no cost. Sydney has opened up the poll, so if you could take a few seconds to answer. Okay, Sydney, do we have the results? Okay, great. So 66% of you said true and 34% said false. Well, let's see what the answer is. Next slide, please. The answer is pretty much true. So the majority of you are correct. Anyone with Medicaid, Medicare, private insurance that complies with the ACA qualifies for free testing for COVID-19 with no copay or no cost sharing. That means literally the cost to the individual is zero. There are a few plans, they're known as short-term health plans that are not ACA compliant. Fortunately, those were actually banned in California, but they do exist in other states. And those specific plans do not have to cover the testing at no cost. Uninsured individuals in California do qualify for free testing under a new presumptive eligibility category under MEDICAID, which I'll go into a little bit more detail later. And then undocumented immigrants federally do not qualify for free testing. However, I will talk about a bill that's pending called the HEROES Act, where some members of Congress would like to see this changed. The good news, again, in California always seems to have the better news, is that in California, undocumented or documented immigrants do qualify for free testing. So living here in California, pretty much anyone does have the ability to get testing for COVID-19 for free, which is great. Next slide, please. So I did already go over the testing when it comes to COVID-19 treatment. And again, these provisions can be found across all the different federal bills that I mentioned. Treatment is to be covered without cost sharing by Medicaid. Medicare said it will cover treatment, but there actually may be cost sharing involved currently if you are a Medicare patient. And then private coverage of COVID-19, whether you have an employer-sponsored plan, commercial plan, or even something on exchange like Covered California, there usually is cost sharing involved, and it varies from plan to plan. Something to note is that I will be talking about how states received an additional bump in federal funding for the Medicaid program, but part of agreeing to receive additional federal dollars was that states had to agree to this no-cost treatment for COVID-19 patients in their Medicaid program. And also there are some provisions being given to providers in the federal bills who choose to cover patients who can't afford COVID-19 treatment. They are able to get reimbursed for that as well. So that's just something to note. And then some of you may also be wondering about the vaccine. That's the top of everyone's mind, I think, when we talk about the future of what will happen with COVID-19. And so currently there is an entity called the Advisory Committee on Immunization Practices that actually issues the recommended vaccines. And it is very likely that they would recommend, once there is a safe and effective COVID-19 vaccine, that is something that should be administered. And both Medicaid, Medicare, and ACA plans all cover at no cost any ACIP recommended vaccines. So in all likelihood, most people would get access to the vaccine at no cost sharing. Next slide, please. And so I mentioned that there are a few Medicaid changes included throughout the bill. Two of the most important ones that I did want to mention. One was the 6.2% in federal Medicaid matching funds. So currently, for those of you who aren't aware of how Medicaid is financed, some of the money comes from the state, and then some of the money comes from the federal government. And the percentage that comes from the federal government varies state to state. You may have heard of it as the FMAP. In California, it's 50%. So that means that for every dollar that is spent on Medicaid, 50% of that comes from California, and 50% of it the state pays for. What has happened with COVID-19 is that the federal government has said that it will bump up California's matching rate so that the federal government will now pay 56.2% of the cost associated with the Medicaid program, and the state can spend less of its own money on Medicaid and then use it for other purposes. And then it also eliminates certain Medicaid requirements, specifically face-to-face encounters. I'll talk a little bit more about telemedicine, but previously, in order to receive a certain type of care for a provider to get reimbursed, that encounter actually had to be in person, and due to COVID-19, it eliminated that requirement. Next slide, please. And then, of course, there were also changes to the Medicare program. It also, just like Medicaid, eliminated face-to-face encounters. It also increased certain Medicare payments for the treatment of patients with COVID-19 to providers. It permits a 90-day supply of any prescription drug during the COVID-19 emergency. So this is really helpful to seniors so they don't have to go every month to get a prescription refill. And then, as I mentioned already, the no cost sharing requirement for a vaccine when there is one that's developed. Next slide, please. And then there were two very specific provisions that aren't probably as well known, but very relevant to women's health that I did want to discuss. The first one is that in the federal legislation, there is language that permits the Small Business Administration to deny those PPP loans to abortion providers. What's interesting is that 38 Planned Parenthood affiliates across the country were in fact successful in obtaining these PPP funds, 80 million in total across all the affiliates. However, recently, the administration has actually asked for that funding back. They've asked them to return loans, and their argument is, as an affiliate and as part of a federation, the Planned Parenthood Federation, they did not qualify as a small business because the federation in total has a lot more employees. Obviously, this isn't a very strong argument because the federation model is very common when we talk about, Komen or Boy Scouts of America, and other organizations that have state or local chapters, and certainly they have received PPP funding and they are not being asked to return it. So that is something that is pending, and it'll be interesting to see how that plays out. There's also something called the Hyde Amendment, which always specifically states that no federal dollars can be used directly towards paying for abortions. It's pretty much included in any federal bill that relates to spending, and that HIDA language was also included in all of these federal bills, just to point out. And then also something that's interesting is a lot of people through their employers have something called health savings accounts, which means that you can set aside a certain amount of your pre-tax income into these accounts, and they can be used exclusively to pay for certain medical expenses, everything from contact lens solution to over-the-counter products. And it also applies to copays and deductibles and things like that. Two things happened with these federal bills. The first was even to purchase something like Tylenol or Advil using your HSA funding, you needed a note or prescription from your physician. So right now they have removed this requirement, so you can still use your pre-tax income dollars in your HSA accounts to buy those over-the-counter medicines. And then menstrual care products actually were never included as a medical expense that you could use your HSA funds for, and now they are. So that's a small but nice win for women when it comes to the ability to pay for certain things related to our healthcare. Next slide, please. And then I think, from a access to care and policy and regulatory standpoint, probably one of the most important changes that we saw in these bills were the telehealth changes. And so now private, Medicaid, Medicare, health plans, they all must allow patients to obtain health care through telehealth during this emergency. And there's really two main things that are important with these changes. The first one is that all of these payers are providing parity for both providers, which means that they are reimbursing providers the same amount for a telehealth visit or appointment as they would an in-person visit. And this is really important because before, this wasn't the case. So a lot of times providers were disincentivized from using telehealth because they would actually receive less money from a telehealth appointment than they would do an in-person appointment. So this provides that parity, and it also provides parity for cost sharing for the individual. So if you had a $20 copay to go in and see your primary care physician, you still have a $20 copay to see that provider over telehealth. And then it also has temporarily relaxed enforcement of privacy laws when using telehealth. Typically, this is governed by a law known as HIPAA. So now any non-public facing remote communication product can be used for telehealth. This includes Skype, FaceTime, Zoom, Google, and the theory behind that was if a provider wasn't already using telehealth, it would have been very difficult overnight to develop a whole new system and adhere to all the HIPAA standards. And so now all of these types of modalities are acceptable. Providers still may not use anything that's public facing like Facebook Live or TikTok or something like that. What's also important to note is providers still have to make that good faith attempt to act to protect someone's privacy. So just because they're using these quote unquote less secure modalities, they still have to make their best efforts to protect privacy. And then California also issued an executive order that has a few more provisions in it. For example, it suspends the patient consent requirement. And so before you had to consent in writing to do telehealth, this just speeds it up and takes away one more step. So you can just provide verbal consent for wanting telehealth. It also gives providers some leeway if there was a breach in privacy as to when to notify the patients. And then something else really exciting is that the California legislature actually passed a bill, and it goes effect in January 2021, that makes the parity changes permanent. And so as you will hear Allison and I talk about throughout this presentation, some of these changes are limited to the COVID-19 healthcare emergency, and it's unknown whether or not they will be permanent permanent or revert back after the emergency is over. In California, at least for commercial plans, the telehealth parity when it comes to paying providers will be permanent beginning next year. And so I think that we will start to see a lot more patients using telehealth, and they don't feel like it's absolutely necessary to go in and see their provider. Next slide, please. And then I did want to quickly, as I wrap up the federal portion of the presentation, mention the HEROES Act. So this is known as the Health and Economic Recovery Omnibus Emergency Solutions Act, and it is the next piece of federal legislation that's being worked on. It did pass the House of Representatives on May 15th, so it's been almost a month now. And as it stands, it doesn't have a chance of passing in the Senate. It's seen as a Democratic bill, and it really is a wish list, so to speak, of all the things the Democrats would like to see in whatever coronavirus or COVID-19 bill is signed into law next. And so it is a starting off negotiation point. But I just wanted to highlight some of the policies that are out there that at least House Democrats would like to see. It's unknown right now. Both chambers are working on a new bill, but it's unknown when that bill will be introduced and passed in both chambers and signed into law. But for example, in the HEROES Act, it does eliminate additional out-of-pocket costs for COVID-19 treatment and the vaccine. It provides even more money to hospitals and healthcare providers, even more Medicaid funding in addition to the 6.2% bump. Again, even more money to some of the agencies like HRSA and SAMHSA, and to some of these programs that I mentioned, like the Violence Against Women Act and Family Violence Prevention Act. Specifically, it gives money to help people go in with nursing facilities who may be experiencing an outbreak, and it also expands the ability for tracing and testing efforts for COVID-19, where we still have a ways to go to bolstering those efforts as well. Next slide, please. And then it also focuses on preventing money specifically to outbreaks in the homeless population. And this is really important. Again, at the federal level, it allows unauthorized immigrants without healthcare coverage to qualify for no-cost testing, treatments, and vaccines. And then it also allows individuals for COBRA coverage to maintain their employer-sponsored coverage after a layoff, reduction in hours, or furlough without having to pay premiums through January 2021. So again, it remains to be seen which of these provisions will end up signed into law, but it's good to know that these are at least in one bill that's passed the House. Next slide, please. And then finally, I'm not going to go through all of these bills for the sake of time, but I just wanted to raise awareness that there are a number of other bills that have been introduced related to COVID-19 and healthcare. And I just wanted to, when you have time, you can certainly go and look at the language. There's a brief summary, but just to kind of create that, again, awareness of other pending pieces of legislation that address specific policy issues related to COVID-19. Next slide, please. Okay, and so now I'm going to talk a little bit about the California May budget revise and touch at the very end on some legislative developments. Next slide, please. So many of you are probably aware that traditionally every year the governor proposes his budget in January, and then he comes out with something called the May revise every May. The biggest change this year, of course, was the COVID-19 crisis. And so whereas in January's proposal, there was a budget surplus, by the time the May revise needed to come out, the state is now facing a $54 billion deficit. So unfortunately, that means there were a lot of cuts that were made and a lot of new proposals on the table that were removed, or things that were supposed to go into effect this year that will no longer go into effect. And so some examples in cuts in funds for existing programs. There was money from the Proposition 56 tobacco tax that specifically gave supplemental payments to physicians, gave money for developmental screenings, provided money for family planning and women's health care. All of that money has been rescinded, and the money is going to be applied to try to reduce the deficit. There's also cuts to money that was being provided for ACEs screening and provider training. There were some carve-outs specific to federally qualified health centers, so that money was taken away. There's a decrease in WIC, Local Assistance Expenditure Authority, and then there are also cuts made to a home visiting and Black infant health program. Next slide, please. And then there, as I mentioned, there are also delays in funding for new programs. So there were things that were tabled that we would have liked to have gone to see in effect this year. For example, the May revise continues to exclude low-income seniors who, based on their immigration status. So before there was a proposal where, regardless of immigration, low-income seniors would be eligible to apply for Medi-Cal. This would affect approximately 22,000 Californians. That is no longer on the table. It also reinstates something called the senior penalty in Medi-Cal. So remember that Medicare is for those who are 65 and older. And although it provides very good healthcare coverage, Medicare certainly still doesn't cover everything when it comes to healthcare costs, and there still are some gaps. And so there are seniors who, if they are low income, qualify both for Medicare because of their age, and then also for Medicaid because of their income and poverty level. And these are known as dual eligibles. And before, you had to be at 103%, 123% of the federal poverty level in order to qualify for both Medicare and Medicaid. What January had proposed was bumping that up, so anyone at 138% of federal poverty level, which is about $17,000 a year, could be a dual eligible. Now they have dropped that back down to the original 123%. So again, we're looking at about 20,000 low-income Californians who could have also been dual, that are no longer be dually eligible. And then finally, it also delayed implementation of a bill that was passed last year, which would have extended Medi-Cal eligibility from 60 days to 1 year for postpartum women diagnosed with a mental disorder. And the good news is it does maintain level funding for some important programs related to women's health. And so it maintains funding for the Domestic Violence Assistance Program. There's funding for sexual health education, STI treatment, and all of those, there have not been any cuts made. And so it really is a hard balance trying to figure out where to cut and how to cut when the deficit is so huge. So we just wanted to bring awareness to all the things that have been proposed thus far. Next slide, please. And then finally, there are California bills that are still in play. What is different about the California legislature versus the federal legislature is that in the federal Congress, you can introduce bills year-round. There's no deadline. In California, there actually is a deadline to introduce new bills, and that was in February, actually, before all of the COVID-19 crises hit. And so there are no quote-unquote new bills that have been introduced specific to the COVID-19 emergency. However, some are certainly more relevant now than they were before. And so the legislature is now back in session for a limited number of days. And what we've been told from some of our partner organizations who are more closely tied to Sacramento is that the legislature will be focusing on very limited number of bills that either are directly related to COVID-19, housing, homelessness, or wildfires. Each senator or assembly person has basically been asked to give their top 1 or 2 bills that they would like to see advance. And most of the bills have to have no cost associated with them, or of course an added bonus is if it lowers the deficit in some way. So again, a lot of the focus will be around the budget. This, by no means, what you see in front of you is an exhaustive list of bills that are still in play. These are just a few of the bills that we've been made aware of that kind of qualify under no cost. They're a top 2 priority of the member that introduced them, or have a significant role to play when it comes to COVID-19. And with that, I will now turn it back over to Allison to go through some of the state regulatory developments. Thank you.